As the aftermath of Cyclone Gabrielle nears the 3-month mark, those affected by the events are encouraged to take stock of their mental health. A range of services and providers are available, and people are being urged to make contact if required.
I think 3 months on, what we're seeing in Hawke's Bay is a variety of different things happening for different communities. We know we've got a lot of different communities who each have their own story about what happened when the cyclone hit, and so their stories have taken different paths as the months have gone on. Some of the communities that didn't feel the cyclone terribly badly have very much returned to everyday life, but some of our hardest hit communities are very much still reeling and are still very much in the thick of dealing with the early days of recovery. And of course that then takes its toll on their mental well-being and their overall health. What we're seeing with mental health and addiction services at the moment is exactly what we would expect. It's what we've been told to expect by other people we've spoken to who have dealt with similar disasters, such as in Christchurch or our colleagues over in Australia and Queensland. And so in the early days after the cyclone, we actually saw people not accessing mental health and addiction services. And what we're seeing now, 3 months on, is we're beginning to see people going back to the mental health and addiction services that are based out in the general practices and out in the communities, but we're not yet seeing those people coming into specialist mental health and addiction services at this time. It became apparent really early after the cyclone that communities helping communities was what we were seeing and is what communities wanted. People wanted to have help from people who were local to them and who really understood their way of life and the way that the community worked together. And so what we've been doing as part of the response is we've been making sure that there's access to training in psychological first aid, and we've offered that to communities from Porongaho up to Wairoa in partnership with Te Aka Whaiora, who are our Māori Health Authority, to make sure that people who are out and working in the communities feel confident about what to do should they be concerned about someone. There's a variety of things that are available, and we've also been really fortunate as a local area and community to benefit from national organisations coming in to help as well. We have seen some charitable organisations come into our area and be able to offer an increase in the number of counsellors who are out and about in the community. In terms of what's available routinely and here for the long haul as well, we have a really good primary mental health service. So they're mental health services that are available to everybody and anybody, even if you don't have a named mental health condition. And you can access them either by your local GP practice or by going on a website, which we can give you, where you can type in your address and see what services are available to you locally. And that'll list everything from providers who specialise in talking therapies, but also includes providers who take a kōpapa Māori approach or an exercise approach to mental well-being. There are also a lot of websites we know that provide free apps, and the website that I can give you, which is Wellbeing Support from the Ministry of Health and the government, also show you how to access those apps as well. So when you're maintaining your self-care, it's really important to be taking care of all the basics, making sure you're eating well, you're sleeping well, but also if that's not happening, asking yourself what might be getting in the way of that. Or if you're noticing a negative emotion or you're feeling particularly upset in one particular setting, asking yourself what might be behind that. One of the things that we're hearing a lot about at the moment is frustration. We're hearing frustration about waiting for things, which is inevitable in recovery efforts. We're hearing frustration because of the damage to our infrastructure in terms of commute. So we're hearing people are having to restructure their days around that. So it's about thinking, okay, in this situation, what can I be doing? Can you make that commute a little bit more enjoyable to yourself? Whether it's choosing a podcast, making sure you've got your favourite drink before you get in the car, or just saying to yourself that you can't change the commute right now, but you can change how you feel about it or what you're thinking about it. This has been an unusual event and in many ways an unprecedented event. Every disaster that we face and we have faced across our country in recent years has been different. So there isn't a blueprint, there isn't a set idea going into a disaster how a community might react. But what we do know is that we're seeing normal responses to an abnormal event.
Here are a range of official service providers. If you or someone you know requires assistance, please get in contact.